Now, the declaration of year 2020 as the International Year of the Nurse and the Midwife by the World Health Organization could not have come at a better time because they risk their lives daily while rendering life-saving services to individuals. It has provided the world an opportunity to celebrate and honor nurses and other healthcare workers for their courageous work, especially in the face of coronavirus pandemic. As health workers at the front of the world's struggle to tackle an invisible enemy, nurses continue to pay the price irrespective of the cost to ensure the public health crisis is tamed. Joining me via Skype is the President, Nigerian Nurses Association, UK, Wendy Olaiwola Odutola. Good morning and thank you for joining us on TVC Breakfast.
Good morning and thank you for having me.
Right, I must say thank you for nursing the world to health. That is part of the theme for this year. But quickly talk to us, in the midst of the pandemic, how much of a challenge are nurses facing at this time? So much so, the World Health Organization had to recognize the efforts of nurses.
Thank you very much. Happy Nurses Day to all my colleagues out there, both in Nigeria and all over the world. Indeed, when WHO declared 2020 as the year of the nurse and the midwife, we were also excited. We were not planned or prepared for this pandemic at all. And as we all know, nurses, with our resilience, we always rise up to any challenges that we are faced with. So in this current challenge, it's so overwhelming that the nurses actually rise up to it as well. So many challenges are not having adequate equipment, especially for those of our colleagues that are in Nigeria. And across the world, I must say even in the UK, we did face that challenges as well, as no adequate equipment, which is personal protective equipment to face this unknown enemy. And I understand that in Nigeria, that is still the case. And if you don't have the arm to go to the war, it is very difficult to actually fight the war. So that's one of the challenges. And also, basically, it's also redeployment during this pandemic. And when you're redeployed to an area that you've never been or you haven't worked in for a very long time, education and training is very much needed. And obviously, because of the impromptu of the situation, people just have to rise up to it, and our nurses really did.
So another aspect of concern to even some nurses is the mental health, ensuring that even after or post-COVID-19, that they are of stable health, especially mentally. How much of a concern is this for you as well?
It is a very much concern because our mental health is our well-being, really. And because nurses have been faced to do those tasks they were not prepared for and trained for, seeing a lot of death around and actually breaking the bad news, it is a secondary role of nurses. And I'm sure all over the world, as it is in the UK, nurses have been asked to call the relatives to break bad news of their relatives passing on. So, and seeing the death as it is, and people just dying every minute, every second. Yes, post-COVID, that's another pandemic, another crisis of mental health that we have to deal with as nurses. But I believe there are supports that are being put in place, and I believe Nigeria is also, or the government, both the federal and the state government, will rise up to the challenge. Both the regulators and the unions will rise up to the challenge, and the peers will rise up to the challenge to support people mentally.
And now my next question would be what your expectation of governments across the world would be, especially seeing that the voices of nurses are beginning to be recognized. What would you expect governments to do this time, perhaps to boost the morale of nurses across the world?
I think one of the aims for the year 2020 is obviously to raise the voice of nurses and to acknowledge and celebrate nurses across the world. So I believe every government across the world will do just that. We celebrate the nurses, not only to celebrate them, we empower them by educating them, giving them the right equipment, giving them the right enabled environment to work, and also making nurses is far beyond bedside, engaging nurses at policy level and bringing nurses to the board level, and also making nurses where the position matters, i.e. ministers of health, commissioners, and I understand in Nigeria, I think we have about 2 or 3 commissioners of health that are nurses. So we are really on the right journey.
Now, how critical are nurses to the well-being, especially the safety of nurses, to ending or flattening the curve, whether be it a community or across as a nation? Because there are concerns of the safety of nurses, especially we've seen cases where patients are being hostile to nurses, even when they go to care for them.
I think the first thing first is to educate our public about the role of nurses, and that nurses are there. Nurses will be the first people they will see at the beginning of going to the hospital, both in the hospital, primary care center. So it is important that the public are educated about the roles and responsibility of the nurses. It is also important that nurses are empowered to provide compassionate care in a good environment, as well as it is also important that the government educate and invest in nurses and in nursing profession.
All right, let's leave it here now. Wendy Olaiwola Odutola, thank you for speaking with us.